The topic of this module is sudden infant death syndrome. The concept is oxygenation. The definition of sudden infant death syndrome, otherwise known as SIDS, SIDS, is the unexplained death after other possible causes have been ruled out, usually during sleep, of a seemingly healthy infant, sometimes referred to as crib death because the infants often are found dead in their cribs. Causes. Most current researchers believe that sudden infant death syndrome is related to multiple causes rather than one single factor. For example, there could be a brainstem abnormality so that the areas that control respiratory and autonomic stressors during sleep do not work properly so that babies don't wake up when stressed. Respiratory infection, cardiac arrhythmias, sleep apnea, prone or side sleeping and bed sharing. Critical development occurs during those first 6 months of life, so abnormalities in growth and development may contribute to the development of SIDS. Covert homicide. Unfortunately, there have been cases where an infant's death has been attributed to SIDS when actually the infant was killed intentionally or non-intentionally. Risk factors for the infant. Number one, gestation. Premature and low birth weight babies are at greater risk. Being part of a multiple birth increases the risk of SIDS. It's believed that with multiple births, crowding in the uterus may impair brain development. Sex. Male infants are more likely to die of SIDS. Age. Infants are most vulnerable during the second and third months of life. Additional risk factors include race. For reasons not well understood, Black, American Indian, and Eskimo infants are more likely to develop SIDS. Infants who have a family history, either a sibling or a cousin who've died of SIDS, are at higher risk of SIDS themselves. Maternal risk factors. Mothers under the age of 20, they may be poor, they may have a lack of social support. Mothers who smoke cigarettes, even if they smoke outside, the smoke is still on their clothing, their hair, and their skin. Drug or alcohol use, inadequate prenatal care. Clinical manifestations. There are no warning signs or early clinical manifestations to indicate a baby will die of SIDS. And there's no magic diagnostic tool to diagnose or predict SIDS risk. A history of upper respiratory infection. The first symptom is the cardiopulmonary arrest. Clinical findings have been found after death. In some infants, there's been an evidence of a struggle or a change of position, the presence of frothy, blood-tinged secretions from the mouth and nose. Because most deaths are unobserved, we do not know the circumstances surrounding the death of these infants. On autopsy, pulmonary edema, intrathoracic petechiae, symptoms of chronic hypoxia have been found in some infants, but not all. Prevention. The first primary important intervention is placing infants on their back to sleep. We must insist on it. Statistics have shown that since this intervention has been instituted and taught to parents and encouraged for parents to follow, there has been a decreased number of deaths related to SIDS. Number two, select bedding carefully. Have a firm mattress and avoid thick, fluffy padding. Avoid toys in the crib. Avoid overheating the infant. Use light blankets. Only pull the blanket up to mid-chest. Do not cover their head. Avoid overheating the sleeping room. Infants should sleep alone. Statistics have shown that infants sleeping in the room with their parents have a decreased risk of SIDS but sleeping in the bed with the parents increases the risk. Offer the child a pacifier. This appears to decrease the risk of SIDS as well. Avoid exposing the infant to infection. Avoid taking them places where they're likely to come in contact with people who are ill. Breastfeed if possible. Nursing diagnoses. A number one, knowledge deficit related to risk factors associated with SIDS. Enhanced parenting related to preventive measures associated with SIDS. Grieving. Compromised family coping. Risk for spiritual distress. Coping and support. Remember that the loss of a child is devastating, not just to the caretakers, but to everyone in the family. It is very important that the parents and all members of the family receive continued support as long as it's needed. Reassure the parents that they're not at fault. They will blame themselves. Let the parents hold rock to say goodbye to the infant. Provide them with a footprint, a handprint, or a lock of hair as a remembrance. Probably one of the most forgotten groups in the death of a child is the sibling. It is important for the siblings to be able to talk about the baby, that the parents be honest with them, that they are able to ask questions, that they are part of the memorial service or the burial. They may feel that their thoughts or feelings, that they were resentful or angry about the baby, that those feelings may have caused the baby's death, and they need reassurance as well. The parents and the siblings should be referred to support groups in order for individuals who suffer from the same kinds of loss may be more supportive. An example of a support group is First Candle. Review questions. Number 1. Which child has increased risk of sudden infant death syndrome, or SIDS? A. A neonate born at 32 weeks weighing 4 pounds. B. A 2-year-old with a broken arm. 3. A firstborn child. D. An infant hospitalized with a temperature of 130 degrees Fahrenheit. Number 2. Which position is recommended for placing an infant to sleep? A. Supine position. B. Side lying position. C. Prone position. D. With the head of the bed elevated 30 degrees. Number 3. Which activity should be recommended for long-term supportive parents with an infant who has died of sudden infant death syndrome? A. Attending support groups. B. Discussing feelings with family and friends. C. Attending counseling sessions. D. Attending church regularly. Answers. Number 1 is A. Number 2 is A. Number 3 is A.